extra practice on your hand through wrist tape. Okay, so as a reminder, start with our anchor strips. Are we able to kind of see anything? Just yeah. Okay, anchor strips. So we were doing hand through wrist. Which side do we start on? Pinky side. Okay, go around, come through the hand, make sure we're pinching it off. Go ahead and get like 3 times through there. And continuous and rip it off. Okay? So just like any other time we're preventing a movement, we are taking them in the opposite direction. So if we were trying to prevent flexion, we're taping them in extension. For preventing extension, we're taping them in flexion. Okay? So our most common is that we're going to tape them probably in some flexion because our most common fall is an outstretched hand into extension. Okay? So there's actually 2 methods that we are able to use. Our first one is our fan method, like when we do our knee hyperextension. So I'm going to have her here, put her in pain-free range of motion. I'm going to go ahead and measure her between the bottom anchor and our anchor through the hand. And then I'm going to go ahead and rest. Come down to our table side, whatever it is. Sorry, James, if you can't see this. You got it. Okay, make our X's. So you see we have a nice wide X. So place them once again, find where our good pain-free range of motion is. Put our tails on the top. Might be a little long. Tails on the bottom. Stick them on there. I'm going to flip her over just because that's easiest for me. A couple of anchors again. I'm going to go one more through the hand and wrist so that you can see, because we need to anchor these top ones down. So that's what we're going to do this guy again. Okay? And then same thing for continuous. Flip it onto the other side. Should help with more of that extension. Okay? So if we were trying to do limit, where did I at now? I did go single slip in there. Okay. So now if we're trying to limit flexion, let's see if I can save this. We're going to put her into that range-free or pain-free range of motion. Put our strips on top here. And same thing, do a couple anchors, do our hand through wrist again to be able to lock it in. Cool? So that's, like I said, our first method. Our second method, we can use our moleskin. If you want to have moleskin, not moleskin, AC tape, sorry. AC tape sitting on our counter. I might have to actually bring some more up. Yes, toss that up. It's a 3-inch, but that'll be okay. 3-inch, obviously better for a larger hand. But actually does our job too. Same thing, measure it out. Cutting it. Yeah, I like to use our table. Make our dog bone pattern, kind of like when we do our dorsal tailor. Then I can split it a little bit, put it around the bottom anchor. I'm going to split it a little bit more towards the top, come to the hand a bit. Same thing. I want a couple of them, and then put our anchors over top of it again. So those are 2 different methods, depending what kind of tape you have, there's resources, those kind of things, and what you find would potentially be stronger or more reliable for your athlete. Cool? Questions on that? Good. You can go ahead and take that off. And then you got elbow, right? Yep, elbow hyperextension. Okay, elbow hyperextension. Obviously, elbow is a hinge joint, so this is going to be basically how we do our knee joint. Okay, when we do our knee hyperextension tape. Same thing, it's just gonna be a little smaller, and we're gonna go up on the arm. So, options, I'm not gonna pre-wrap you, sorry. So typically we would anchor, so we wanna anchor about mid bicep, maybe even a little higher if you want a little bit of leverage, so about mid forearm, okay? Typically you're gonna anchor with your shear light or something a little bit stretchier, but if not, I wanna have you make a bicep, flex those muscles. Okay, anchor, and then I want you to flex your forearm. Okay. Typically, as if we have this tape, I would actually do probably 2 anchors at the top, 2 anchors at the bottom. Okay, so same thing. So we're gonna find ouch, ouch, or where it hurts, ouch, ouch, ouch. Come back just a little bit, and we're just gonna make our fan again. So we're measuring. So we'll go ahead and measure. You can go and relax. So this is gonna be a little bit longer on the fan. If you need to, you can use as many strips as you feel is necessary. That'll make a nice, strong band. So we're finding that position again. Ouch, ouch, ouch. Bring it back a little bit. Tail in here. Sorry, my tails are not all the same length. Get in here. Same thing. We're going to do our 2 anchors. Sorry, flex that bicep. 2 anchors at the top again. Flex the forearm. I'm just going to do 2 or 1. Okay, and then we might have a little bit of stickiness underneath there. So even before you put it on your athlete, take a strip, wrap it around. So you'll get a little bit of stickiness up here and down here, but that way it's not truly sticking in that elbow joint, which is really going to cause some irritation in there, especially if you don't do any pre-wrap in there. And the thing with doing, which I found with the knee too, with doing a pre-wrap, a lot of times that pre-wrap is going to slide and it's going to lose its effectiveness. So a lot of times for this type of tape job, taping directly to the skin is going to stick and adhere better and be able to prevent that full extension that we need it to. Okay. Same thing with this guy too. If you really wanted to, you could use your elasticon. Same thing, measuring here. I don't know if I would cut this one and split it, but I would go a middle, and I would do one comes across here, and then one that comes across here to create our X and our straight on. But I don't think for this one I wouldn't necessarily tear it and make a dog bone. I think it would lose some of its tensile strength. So same thing. So either white tape, AC tape, or elasticon, whatever kind of supplies you end up having or whatever is in your kit on the road. Pretty straightforward. Questions about that? Pretty simple.
I was expecting it. Still shocked me.
I'll let you. Okay.
Go for it.
All right, and then last one for today is an AC. Is it just called AC tape or AC?
AC tape, hanger tape,
AC hanger,
something. AC tape.
So not super common. Somebody that has an AC tape or AC injury, more than likely where they're going to put them in spica or put some type of AC pad on top of them. The only time I would do like an AC hanger tape if it's somebody that actually needs to maybe reach up or try and have a little bit more mobility instead of having a giant pad on their shoulder. We could do it. I actually did a version of this on a soccer player before, except I used KT tape, but kind of the same concept of what it is. So if you look in, are you able to pull up your thing? So if you look at your book or you look up the actual mode, so it uses our Omniflex or our coverall strip, and I think it actually uses Google tape. Is that technically what it uses? So like when we use our McConnell tape job on our knee, we use the coverall and the Google tape for it because it's a nice hard tensile strength. So when we have an AC sprain, so hopefully you can all find your AC joint and follow along that clavicle. And then right where we have kind of a drop off point, so that's our AC joint, acromioclavicular joint. Typically when we have our AC sprain, that joint is loose. so that our clavicle kind of starts sticking up a little bit. So with this kind of tape, we're trying to take that clavicle, pull it down, and make that AC ligament shorter. Does that kind of make sense? Okay. So I'm gonna kind of come in here. So we're doing this tape, we're gonna put our coverall on. So we're actually gonna do a coverall strip here from about mid-deltoid up to about where our trap meets. And then we're gonna do another strip up from our CC, our coracoid ligament, clavicle coracoid ligament, over our AC, and kind of come back to about our supraspinatus. Okay, so we're up top and we're on to the side. I'll go ahead and show it. I'll just put this tape on. Okay, so you can kind of pretend with our white tape. So imagine this is our coverall. Okay, we're gonna come on top. So with the coverall, you're not actually making any pulls or any movements. It's just there as our base. Okay. I don't have a different colored tape, do I? Do you have a marker? Hold on. Oh, I'm not coloring. Should be enough. Okay, so we're gonna do 2 strips. We're gonna still measure from like our middle deltoid to our top. This one you might actually need somebody to kind of help you. We need to have that shoulder lifted up superiorly. So we're gonna take our tape, sit here, pull her up and in. Okay, so we're taking that humerus and pulling her up. So that's gonna help keep that that scapular head up onto a position. Okay, now we actually need to take that clavicle and push it down. So I'm going to start in the, which one is the start?
I don't think it matters.
I don't think it really matters. Okay, so we're going to start in the back, come over top, and actually forcefully take where that clavicle comes over, pushes it down, and that's going to hold her. Okay, and then we can go ahead and relax. So the first tape helps hold up our humerus. Second tape actually pushes down that clavicle. Okay. So when we have that separation of the AC ligament, we are pulling up. We're pulling this guy up and pushing this guy down to try and level that playing field again. Because otherwise with an AC sprain, you're going to be offsetting, especially depending on the severity of your sprain. So if it's a 2, you're going to see a little bit more of a step off. If it's 3, huge step off / completely torn. Grade 1s, you might not see too much of a step off. You might feel it. You might not see it, but we're just trying to basically level those 2 primary spots down so that AC ligament is less strained. Make sense?
And we keep this one on there because this one actually has a lot of really good research on if they wear it all the time, it will actually help heal that better opposed to even cosmetically. You know, people that have AC sprains that have tears, it never really heals. But if they wore this for like 6-8 weeks, it might heal a little bit, or it does heal a little bit better according to research. So
because like I said, it helps that humerus pull up. So just on a natural day-to-day, going about your day, there's going to be that separation of the AC ligaments. Like I said, yeah, you're just trying to allow it to heal. A lot of times, like we put athletes with ankle sprains into boots to help try and let the ligament heal faster because it's not being used. Kind of the same concept with this. So like I said, I have done a similar type of thing with KT tape. I would take the tape, I pull her humerus up, and instead of like actually pulling over, I think I split and when we get to KT tape, you'll understand a little bit more. I put a little bit of tension on it and basically put it straight down and put the same amount of tension on the anterior and the posterior, just to kind of hold that clavicle down a little bit. So, cool. That's all we got for today. So, use this time. So, AC tape. Thanks, Cameron. Always appreciate it.